What if catching cancer early could save your life? With simple checks for testicular cancer and groundbreaking treatments for colorectal cancer leading the charge, that's a possibility sparking hope, driving innovation, and reshaping how we fight this disease. Welcome to Healthy Start, your go-to channel for science-backed tips to live healthier and stronger. If you're new here, hit that subscribe button for Healthy Start and ring the bell to stay updated with every eye-opening video. Today, we're diving into the critical world of early cancer detection, focusing on testicular cancer strategies and the latest advancements in colorectal cancer treatments, offering a glimpse into how timely action and cutting-edge care can turn the tide. Let's explore what this means, how to spot the signs, and what new options are on the horizon. It all began with a wave of attention around recent health breakthroughs that have people talking. A series of studies and reports have highlighted the power of early detection, particularly for testicular cancer, where regular self-exams can catch issues before they spread. At the same time, colorectal cancer treatment is seeing a revolution with new methods that promise better outcomes and fewer side effects. These developments have caught the eye of medical experts and patients alike, offering a dual focus: spotting cancer early to improve survival rates and embracing innovative therapies to enhance quality of life. The findings, detailed in leading health journals, suggest a future where proactive checks and advanced treatments could transform the cancer journey, making it a story of empowerment and progress. Let's start with testicular cancer, a condition that often strikes younger adults but can be highly treatable when caught early. This type of cancer begins in the testicles, the male reproductive organs, and can present as a lump, swelling, or discomfort. The key to beating it lies in early detection, and that starts with regular self-exams. Health guidelines recommend men check themselves monthly, feeling for any changes in size, shape, or texture while showering or standing. The reports emphasize that most cases are curable if found before spreading, with a survival rate above 95% when detected early. Symptoms like a heavy feeling in the scrotum or sudden pain shouldn't be ignored, prompting a visit to a doctor for ultrasound or blood tests. It's a simple habit that can make a life-saving difference. So, how do you perform a self-exam? It's straightforward and takes just a few minutes. Stand in a warm shower where the heat relaxes the scrotum and gently roll each testicle between your fingers, checking for lumps or irregularities. The report suggests doing this after a warm bath, using both hands to ensure thoroughness. Any unusual finding, a hard spot, enlargement, or ache warrants a checkup. Doctors may follow with imaging or tumor marker tests, like alpha-fetoprotein levels, to confirm. The process is empowering, putting health in your own hands, and the data backs its effectiveness, with early detection linked to less invasive treatments and faster recovery. Now, let's shift to the treatments that follow detection. For testicular cancer, options depend on the stage. Early cases often require surgery to remove the affected testicle, a procedure called orchiectomy, which can be followed by surveillance to monitor for recurrence. If cancer has spread, chemotherapy or radiation might join the plan, targeting remaining cells. The reports note that advances in chemotherapy, like reduced-dose regimens, minimize side effects while staying effective. Survival rates remain high, even in advanced stages, thanks to these tailored approaches. It's a journey of precision, where early action sets the stage for success, and ongoing research continues to refine these methods. Turning to colorectal cancer, the focus shifts to both detection and treatment innovation. This cancer affects the colon or rectum and often develops slowly from polyps, making screening a game changer. Regular colonoscopies, starting around age 45 or earlier with risk factors, can spot and remove these growths before they turn cancerous. The reports highlight that early detection boosts survival rates to over 90%, with symptoms like blood in the stool, unexplained weight loss, or changes in bowel habits serving as red flags. Stool tests and imaging offer additional tools, encouraging routine checks as a preventive measure. It's a proactive step that can halt the disease in its tracks. The treatment landscape for colorectal cancer is evolving fast. Surgery remains the cornerstone, removing tumors and affected sections of the colon, but new approaches are making waves. Recent studies detail a breakthrough therapy combining immunotherapy with targeted drugs, earning a breakthrough therapy designation from health regulators. This method, already used globally, shrinks tumors before surgery, sometimes avoiding it altogether, and opens doors to less invasive options. Chemotherapy and radiation continue to play roles, but these innovations reduce their intensity, sparing patients from harsh side effects. The reports cite a decline in colorectal cancer deaths over the past decade, crediting earlier detection and these advanced treatments, marking a turning point in care. Let's dig into how these treatments work. Immunotherapy harnesses the immune system to attack cancer cells, using drugs like checkpoint inhibitors to boost the body's defenses. Targeted therapies focus on specific cancer traits, like gene mutations, delivering precision strikes with fewer collateral effects. The breakthrough approach, tested in clinical trials, showed tumor shrinkage in over 70% of cases, allowing some patients to skip surgery. Radiation techniques, like intensity-modulated radiation therapy, target tumors more accurately, protecting healthy tissue. These advancements, detailed in health publications, reflect a shift toward personalized care, tailoring treatments to each patient's needs and improving outcomes. The importance of early detection can't be overstated. For testicular cancer, self-exams catch issues at stage 1, when cure rates soar. For colorectal cancer, screening removes precancerous polyps, preventing the disease entirely. The reports note that delayed diagnosis often leads to advanced stages, where treatment is tougher and survival drops. Public awareness campaigns push for regular checks, with doctors trained to spot risks like family history or lifestyle factors. It's a collective effort, where education and action converge to save lives, turning detection into a powerful tool. Support during treatment is crucial. Patients undergoing surgery or chemotherapy for testicular cancer need follow-up care, monitoring for recurrence with scans and blood tests. For colorectal cancer, post-treatment surveillance tracks for new growths, with diet and exercise aiding recovery. The reports suggest support groups and counseling help manage the emotional toll from anxiety about surgery to adjusting to treatment side effects. Nutritionists recommend anti-inflammatory diets, while physical therapists guide safe movement, building a recovery network that strengthens resilience. Research is driving these advances forward. Scientists study tumor genetics for testicular cancer, improving targeted therapies, while colorectal cancer trials explore immunotherapy combinations. The reports highlight funding boosts for early detection tools, like better imaging or non-invasive tests, promising faster diagnoses. Collaboration between researchers and clinicians fuels this progress, turning data into life-changing solutions. It's a dynamic field, where every discovery builds on the last, offering hope to those affected. As we wrap up, early detection and new treatments are rewriting the cancer story. Self-exams for testicular cancer and screenings for colorectal cancer, paired with innovative therapies, offer a path to survival and well-being. Thanks for joining me on this deep dive into cancer detection and treatments. If you found this video helpful, give it a thumbs up and share it with someone who needs to know. Don't forget to subscribe to Healthy Start, hit that bell, and stay tuned for more valuable videos. See you next time, and here's to a healthier future.